So this is very much an interesting topic currently, and there is a lot of evidence that's coming, which is fairly new. So there is a lot that we need to look into how robust these data are. But as far as we know, long COVID is a condition that can happen as a result of multi-organ sequelae following an acute phase infection, and that leads to long-term sequelae in anyone. And that could be because of viral pathologies, immunological dysfunction, and inflammatory damage as well. Now, we know that women developing long COVID are female and aged below 50 years. However, we know that mortality risks are higher in men, those who have comorbidities and increasing age, but they are not linked with long COVID symptoms. Now, there are some observational studies which link, like in conditions like HIV, hepatitis B, hepatitis C, where there is viral-related sex hormone dysfunction that results in early menopause, menstrual abnormalities, and miscarriages. So this evidence is mostly from other viruses, chronic illnesses that we know of. However, with long COVID and following an acute infection, we think that there may be similar pathogenesis where there is ACE2 receptor protein expression in the ovaries that results in temporary disruption of physiological function of the ovaries, resulting in abnormal hormone production, as well as resulting in symptoms of perimenopause and postmenopausal symptoms. So it is a very interesting question because, as you know, there are symptoms which go with menopause, and those symptoms almost go parallel with the long COVID symptoms. So for instance, long COVID symptoms are fatigue, chronic fatigue, muscle aches, palpitations, cognitive impairment, and sleep disturbances. And these are very much the symptoms that women do get when they are postmenopausal. And these overlap, the overlap that happens in symptoms really creates a big challenge in diagnostic criteria and creates uncertainties for clinicians to be sure whether this is long COVID or menopausal symptoms. However, there is, if we don't diagnose this, there is a missed opportunity because of the long-term comorbidities that happens as a result of menopause that links with cardiovascular issues, type 2 diabetes, osteoporosis, long-term dementia, and other abnormalities. So as clinicians also, although it is challenging to diagnose these two conditions, it's important to take a detailed history and relevant tests to establish the diagnosis so we treat patients accordingly. If you look into the diagnosis of menopause, it's from symptoms as well as from hormonal tests. So we always say the process of change takes up to 5 to 7 years. And in that time, you could have a lot of symptoms, which includes hot flushes, night sweats, insomnia, you have irritability, you have loss of cognitive abilities and brain fog, and many other symptoms. There could also be other area symptoms, like you could have vaginal dryness, you may find it difficult to focus, you will have forgetfulness, many other symptoms could be associated with this as well. The simple test that we do to diagnose menopause is by doing a blood test called FSH. It's a hormone that increases as ovary starts to reduce in its function. The levels we do is 2 levels to diagnose, and if both levels are about 30, then it is considered as menopausal changes in women. These things may happen as symptoms come first, followed by blood test abnormalities. So we always say when symptoms affect someone and it affects the quality of life and their day-to-day performance, and that is both at home and at work, then it's important they see a doctor to discuss these symptoms, establish a diagnosis, and have a right treatment so that helps to reduce and alleviate their symptoms. Menopause is a physiological change that happens in women. So it's so important we take this not as an abnormal condition and treat it with just hormones. There should be a holistic approach to this. And hence, I always think we need to look at different things, including, attention to diet, attention to lifestyle changes, attention to the treatment that is available. The treatment that is available ranges from hormone replacement therapy. There is also other prescribed medication that is available in the market, alternative therapies and alternative treatments. So this could range from hormonal to non-hormonal treatment. As well as there is an important focus on lifestyle change, because as you understand that comorbidities linked with menopause is osteoporosis, cardiovascular problems, and other conditions that need lifestyle changes. So it starts with lifestyle changes, then we get into other treatment that is available for menopause.